Every year, 275,000 women die of cervical cancer, and 80% of these deaths occur in the developing world. In Ghana, cervical cancer is the leading cause of cancerous death in women, yet less than 5% of women have ever been screened. Cervical cancer is highly preventable, given that regular screening significantly reduces mortality. The Pap smear, which is the most common screening method in the US, is expensive and ill-suited for countries like Ghana. But there's an alternative method called visual inspection with acetic acid, or VIA. Instead of depending on a lab to interpret the examination results, as is necessary in a Pap smear, VIA results can be interpreted during the examination. To perform the VIA, a midwife applies acetic acid or table vinegar to a woman's cervix, and after 1 minute, any precancerous cells appear as white lesions. VIA is simple, but it depends on the examiner's experiential knowledge and on-the-spot diagnosis. So despite its promise and its favorability in Ghana, VIA isn't widely used because most midwives aren't formally trained in the method. Our organization, Visualize, has worked with healthcare providers across Ghana for over 2 years. We've conducted research with a variety of doctors, nurses, midwives, and others, and our collaboration with these health workers led us to develop a training model to support midwives as they learn to screen for cervical cancer. While a number of people and organizations have attempted to address the issue of cervical cancer screening and detection, none have focused specifically on developing and distributing an effective training method. This is the gap that we are working to fill. We've developed a prototype of a VIA training model to support midwifery education. This model provides its users with a realistic clinical experience where they can practice the VIA procedure at their own pace. We've received funding to develop the training model so far, but require more funding to continue moving toward implementation. We're using this crowdfunding campaign to reach out and ask for your support. With your support, we plan to hire a team of Ghanaian engineers to work with us as we continue to evaluate and redesign the training model. These engineers will be able to provide their technical expertise along with their knowledge of local capabilities. This will help us ensure that the program may be successfully rolled out and taken up. We're passionate about maintaining a culturally respectful relationship with our Ghanaian collaborators, and by working with Ghanaian engineers, doctors, midwives, and administrators, we believe we can mutually work toward easing cervical cancer mortality. Our approach addresses the larger issue of cervical cancer mortality by focusing on leveraging existing midwifery skills and knowledge. By providing midwives with the tools to learn VIA, we believe that more cervical cancer screenings will be performed, and therefore cervical cancer mortality will decrease.